Welcome once again. With no further ado, I think that we're going to start the event now. I want to tell you that for this event, we will have some opening remarks with the three organizations that work on this to make this guide possible, which are HelpAge International, the organization Pan-American Organization of Health Institutions as well, and also some low-cost programs that were conducted in Latin America and the Caribbean. Then we'll have a panel with special guests, also some questions for them, and finally the concluding remarks. So with no further ado, I want to welcome Stephanie Firestone from AARP International. She is the Senior Advisor for Strategic Policies focused on communities, health, and elderly populations. Welcome, Stephanie. Thank you. Welcome.
Bienvenido.
And thank you very much for counting on us to launch this guide for community low-cost interventions so that they are friendlier with the aging process. My name is Stephanie Firestone. I am from AARP in the United States. As you just heard, I am a student who's learning Spanish. So I will be giving my presentation in English.
AARP is a non-governmental, nonprofit organization whose mission is to empower people to choose how they live as they age. This is a critical mission because around the world, the population is aging rapidly. In 2018, for the first time in history, people 65 and over outnumber children under 5. And the number of people 80 and over is projected to triple from 143 million in 2019 to 426 million in 2050. While this is happening more quickly in middle and higher income countries and in urbanized areas, population aging will be a reality almost everywhere in the next 2 decades. One of the ways the groups who created this toolkit are helping people to have a higher quality of life as they age is to help make their neighborhoods and communities more age-friendly, as defined by the World Health Organization's global network of age-friendly cities and communities. This includes social dimensions like work and volunteer opportunities and showing older people respect. And it includes physical dimensions of the community, or what we call the built environment, which is the focus of much of today's discussion. Things like appropriate housing options, opportunities for people to safely and inexpensively get where they need and want to go, and a public realm or outdoor spaces and buildings that make them feel welcomed and encourage their engagement and participation in physical, social, and other activities that can help them to thrive. Most age-friendly community initiatives have taken place in middle and higher income communities. And the process of joining the WHO's global network demands time and resources that are often lacking in many lower income communities. Yet individuals and small groups of people in communities around the world can take and are taking meaningful actions to make their communities better support themselves and their neighbors as they age. And innovations come in all shapes and in large and small sizes. So we need to provide support and to learn from the creativity and innovation that is happening everywhere across the globe. We created this toolkit to help communities begin or advance their age-friendly journey, starting wherever they are. We hope it will inspire communities everywhere to take some initial, often small yet important actions that can show impact, build momentum, and drive a desire and commitment to do more. Perhaps someday even join the global network. Next, my colleagues from our partner organizations will say a few words. The project manager will share more detailed remarks about the toolkit, and then we will hear from local innovators from 5 Latin American countries. So now please welcome my colleague, Marcela Bustamante, for some remarks. Gracias.
Good morning, ladies and gentlemen.
Bueno,
Well, at
como
HelpAge
HelpAge
International,
Internacional,
we are very
estamos muy
excited to be able
emocionados
to
de poder
launch
lanzar el
the
día de
guide
hoy
Vamos
la
a
guía Vamos a
lograrlo
lograr
today. These are the
pasos
steps to
para
involve
involucrar a
the
las
elderly
personas
and
mayores
improving
y mejorar
communities
las
for all
comunidades
age
para todas las
ranges.
edades.
We feel
Nos
honored
sentimos
to
muy
know that
honrados
all
de
of
ver que
you are
todas
accompanying us
ustedes están
today.
acompañando en el día de hoy.
I would like to thank
Quisiera especialmente agradecerle a
AARP, especially
AARP
because with their
por su
invaluable
invaluable
support,
apoyo
they have
que han
made it
hecho
possible
posible
to
la
materialize this
materialización
guide as
tanto de
well
estas
as the
guías como
initiatives
de
that
las
we are going
iniciativas
to
que
present in this
presentaremos en
launch.
este
I
lanzamiento.
would also like to
Quisiera
highlight
resaltar el
the
valioso
wonderful
acompañamiento
technical
técnico de la
support from the
Organización
Pan-American
Panamericana de
Health
la Salud
Organization so
para
that
que
these
este
efforts
esfuerzo
can
haya
become a
sido
reality.
posible. Mil gracias
And
también
also,
a
thank
los
you to the
82
82
aplicantes
applicants
que
that
respondieron a la
responded to this
convocatoria
call
y
and invitation,
compartieron sus
and they shared their
iniciativas de bajo
low-cost
costo,
initiatives.
que si
Even though
bien
we
no
weren't able
pudimos
to mention all
seleccionar a
of them, we
todas,
do hope that this
esperamos que
guide
esta guía
is a
sea una
tool that
herramienta que
can
facilite
help us
la
to understand
comprensión de
all
las
these
actividades que
wonderful
ya han hecho.
ideas.
No
I
puedo
cannot
concluir mi
forget
saludo de bienvenida sin
to thank the
agradecer a los
partners who
socios
gave us the
que nos dieron la
opportunity
oportunidad de
for us
acompañarlos
to
y
help them
aprender
and
de
learn
sus
from their
iniciativas,
initiatives. And we will
que
be
tendremos el gusto de
able to
escucharlos
listen
en
to
el
them in the
segundo
first
panel.
panel. I also want to
Igualmente
thank Dr.
agradecerle a la
Las,
doctora Las,
JICA,
a
the
JICA, la
Salgarguea
Fundación
Concha
Salvador
Foundation,
Concha y
and
a la Universidad de Salud
University and
que
Health,
hoy nos
who will
estarán
also be
acompañando en el
joining us in the
segundo
second
panel.
panel. So now,
Ahora
the
bien,
guide,
la guía
Vamos a
Vamos a
lograrlo,
lograrlo es un llamado a la
is
posibilidad
for us to
que todos
understand that
tenemos
we
para
are all
convertirnos en
capable of
agentes de cambio
becoming
en
change
nuestros
agents in our sectors
entornos
and
y
communities so
comunidades
that these are
para que
friendly
estos
with
sean
the elderly
amigables con las personas
populations.
mayores.
We hope that the guide
Esperamos que la guía
serves
sea
as an
inspiradora
inspiration so
para que
that
ustedes se
you
animen a ponerla
are
en
willing to
práctica.
implement it. Thank you very
Muchas
much.
gracias.
So now
En
I
este
am going
momento
to introduce my
introduzco a la
colleague,
colega
Patricia Moore.
Patricia Moore. Es
She's an
asesora en
advisor
envejecimiento
in
saludable de la
healthy
Organización
aging
Panamericana de la
from
Salud.
the Pan American Health Organization.
Buenos días, buen día, good morning.
Good morning. My
Mi nombre es
name is
Patricia Monge,
Patricia Monge.
soy la
I am the
asesora en
advisor on
envejecimiento
healthy
saludable de
aging
la
from the
Organización
OPS.
Panamericana de
And
la
I
Salud.
also
Y quiero
want
hacerles
to
llegar el
send
saludo de todo
greetings
el
from
equipo
the
de
Healthy
la Unidad de
Life
Curso de
course
Vida
and
Saludable de
from
la
the Pan
OPS
American Health
y también
Organization in the
envejecimiento
Healthy
saludable.
program. I am
Estoy
very happy
contenta
to be
de
joining you
poder
today
acompañarlos
together
hoy
with my
junto a
colleagues at
mis colegas
HelpAge
de HelpAge
International and
International y
AARP
AARP
in the launch of
en el
this guide,
lanzamiento de
which we
esta
hope
guía,
it serves
que
to
esperamos
inspire
sirva
all
para
people who
inspirar
are
a
joining
todas
us
las
today
personas
so
que hoy
that
están acá
we can
para lograr cada
achieve
vez más
friendly
entornos
environments with the early
amigables con las
populations
personas
in the
mayores
region of the
en la
Americans
región de
as
las
throughout the
Américas
world.
y en el mundo.
As my colleague
Como
Stephanie
mencionó
mentioned
mi
in
colega
her welcoming
Stephanie en sus
remarks, in
palabras
the
de
past
bienvenida,
decades,
en
we
las
have
últimas
expanded the
décadas se ha
opportunity of living
expandido
in the
la
Americas
oportunidad de
and the
vivir en las
world.
Américas
But
y
it
en el
is also
mundo.
important to
Pero
highlight
es
that
importante
even though
resaltar
people are
que aunque
living
las personas
more,
están viviendo
they are
más,
not
no
necessarily
necesariamente
enjoying better
gozan de mejor
health.
salud.
The
La
difference between
diferencia entre la
health
esperanza de vida
expectancy
y la
and a healthy
esperanza de
health
vida
expectancy
saludable
is almost
es de
11
casi
years in the
11 años
Americas.
en las
This
Américas.
is a fundamental
Este es
challenge
un
for the
reto
region.
fundamental para la
We need to
región.
make sure that
Debemos
our
lograr que
citizens
nuestros
don't just live
conciudadanos
longer,
no solo
but that
vivan
they do
más,
it in
sino
health
que lo hagan
and
con
in
salud
well-being
y
in the
con
longest
bienestar
time
el
possible.
mayor tiempo
The
posible.
surroundings
Los
are a
entornos
fundamental
son una
aspect for
pieza
healthy aging,
fundamental para el
and
envejecimiento
they
saludable
include
y
all
comprenden todos
factors
los factores
from the
del mundo
outside that
exterior que
create the life
forman el
context of a
contexto de vida de
person,
una persona,
the
el
household, the
hogar,
community,
la
and the
comunidad
society
y
at
la
large.
sociedad
To promote the actions towards healthy aging, the period between 2021 and 2030 was designated by the United Nations as the Decade of Healthy Aging that promotes actions of collaboration between different stakeholders to improve the life of the elderly, their families, and communities. This decade includes 4 areas of action, including ensuring that communities promote the capability of elderly people. This is why it is so relevant to look at the publication of this guide that we're launching today, not only because it describes experiences that have proven to be successful in different countries in the region, but also because it is expected to be a guide that serves to inspire actions of all of us. As my colleague Marcela said, it invites us all to think about what is possible with the available resources that inspire us by presenting innovative ideas that keep the elderly in the center as the main promoters of change. The region of the Americas has developed active work in the age of aging in the past decades, especially in addressing the different social dimensions and physical dimensions of our surroundings. Currently, this is the region with the higher growth in the WHO's global network. Even though we have made great progress towards healthy aging and in the creation of friendly environments, we also need to work on more specific actions, measuring results and the sustainability of the programs. This is why I want to invite all of us to read this guide, which is available in Spanish and English, so that you can share it with others and use it with inspiration to trigger more actions of this kind. Finally, I want to thank my colleagues at HelpAge International and AARP for their coordinated efforts in preparing this document, and also to work on the different high impact and low cost initiatives that have been implemented in countries in the region. From the Pan American Health Organization, we are available to accompany you towards the objective of achieving healthier environments with the elderly populations and to promote the capabilities of all of us. Thank you very much. Obrigada. Gracias. Now I want to give the floor to my colleague Sean Jones, Urban Inclusion Advisor at HelpAge International. Thank you, Patricia. Good morning, everybody. I'm really sorry because I'm also going to be speaking in English.
Thank you, Patricia. It's been a pleasure working with you and everyone else who's been involved in this project over the last 18 months. I'm Sean. I've been working with HelpAge International on how to create more inclusive cities and communities for a number of years now. The guide we're launching today builds on the hard work and the ideas of other people, sharing their successes and hopefully encouraging others to take the work forward. It provides step-by-step advice on how to develop a strategy, build coalitions, campaign with the voice of older people, and take simple and low-cost actions. In the few minutes I have to speak, I wanted to reflect on one of the themes of the guide: how older people themselves can create shared spaces that are meaningful and valuable for them and their communities. So often, I think the urban planning, design, and architecture disciplines focus on physical accessibility as the key to inclusion. Of course, creating spaces that everyone can physically access is fundamentally important. But older people are often excluded from shared spaces for more reasons than just physical accessibility. Other barriers can include declining confidence, a fear of crime, not feeling a part of the city, or that a shared space, such as a public square or a park, is somewhere where they feel they can belong. I think understanding these barriers and how to overcome them is where a lot of us on this call today, and our understanding of the complexities of aging can make a real contribution. We know that opportunities for social interaction, building intergenerational relationships, having places to relax and spend time outside of the home are really important for older people. And we increasingly understand how to create places that older people actually want to go to and spend time. places where they feel safe and confident, places where they feel celebrated and where they feel they belong, and places where they actively participated in the creation of that space. With this in mind, I wanted to reflect on how some of the ideas featured in the guide that we're launching today, and we're going to hear more about during this session, achieve the creation of spaces and connection to the community that older people really value. For example, from Brazil, we're going to hear an example of cycling for older people that brings people out into the community and builds their confidence in getting around. From Colombia, we're going to hear about community gardens where older people created together a shared space where they feel a sense of ownership and a sense of belonging. Outdoor physical exercises classes, in Argentina act as a reminder that older people don't need to be indoors and closed off from the world, but they have a right to take space in their communities. The guide also features lots of other examples, including from Chile and the US, where groups of older people co-created murals that created a sense of ownership and also shows how older people can lead in improving their community for everyone. I really love these examples of change that create places older people want to spend time in and the meaningful connections they can build with their communities. They provide real opportunities for older people to socialize, to participate, and to claim their right to exist and be present in their community. So then where do we go from here? I think with all these great examples, I think a key action we can do is to gather more stories, more evidence, and more data of exactly why these kinds of initiatives are important for older people and to highlight the impact they have on their lives, which isn't always immediately obvious. With more data and evidence of how these places reduce loneliness and isolation, build intergenerational connections, and provide opportunities for older people to meaningfully participate and feel empowered, we can really start to talk to stakeholders about why these initiatives are so important and the impact that they have. So I'm going to hand back to Valentina now, who's going to take us through some of the great initiatives that have been funded as part of this project.
Welcome back again. I want to remind you that for the interpretation, you just need to click on the interpretation button and you can choose the original audio without interpretation, or when they switch the language, you can choose the language that you want to hear the session in. Okay. So now, first of all, I want to thank Sion, and now we're going to tell you about the content of the guide. We are going to talk about with some people who implemented these low-cost initiatives that contributed to the development of friendlier communities with the elderly populations, and it's important to highlight this, that also include the elderly. Our guests for today are Lisandro Vergara from Brazil, Abra Caliman from Colombia, Maria Fernanda Vendano from Costa Rica, Sylvia Manzano from Argentina, and Mr. Segura from Dominican Republic. If you have any questions, you can also write them in the Q&A section, and someone will be giving you a response. Thank you. So now we are going to have a short discussion. So with no further ado, we want to welcome Aura Caliman. She is from Colombia. She is a social leader and an elderly who implemented an initiative in Ciudad Bolívar, a popular and vulnerable neighborhood in Bogotá. She has specialist in human development in creation of creative aspects. So Aura, welcome. Can you tell us about the project? Yes, thank you, Valentina, for the opportunity to be here, and I want to thank HelpAge as well. Our proposal is based on these urban gardens, and with the exclusive age of HelpAge, we were able to materialize this so that we can provide hope for the elderly. This is about a training process to technify and improve plantation techniques so that we can plant and harvest, and also a process in human rights training for the elderly based on the Inter-American Human Rights Convention. And this planting and harvesting is conducted by elderly. They take turns, as we can see, so that they can care for and they can protect and they can water the plants. And then these products are shared amongst them with the intention to improve the quality of life and the food chain for them, and also to change their habits of consuming flour and carbohydrates. And this has allowed them to improve the production of their crops. And also we look at the opportunity to find other elderly people who want to join this proposal. We are also promoting these household gardens, because one thing would be on site where we have these public spaces that we can use, and a different situation is to have availability directly at their households of the participating members. This would create security for them. They strengthen their friendship bonds, and this gave us the opportunity of mitigating their needs and the vulnerabilities of the elderly population. And therefore, this gave us the opportunity of starting working as an observatory to be able to be closer to these needs and vulnerabilities. Thank you. Thank you very much, Aura.
Mil gracias, Aura.
Aura, I do have a
Aura,
question
yo
about
tengo
this,
una
because
pregunta
these
respecto
orchards
a
were
estos
also
huertos se hicieron en zonas
implemented in
vulnerables
vulnerable
en
areas
Colombia
in
y más o
Colombia.
menos lo que nos ha
And we were
preocupado es que
told
hubo
that there were
cambios
some
también
changes in
tras las
social dynamics.
negociaciones.
So we
Entonces
wanted to
queríamos
ask you
preguntarte si
if you believe, according to what you
consideras,
have
según lo
seen,
que has
that there
visto,
is a
que hay
connection
un
between
vínculo
this
entre el desarrollo de zonas
implementation of
urbanas y la
urban
disminución
gardens
de la
and the
violencia
reduction
en
of
estos
violence in
lugares.
these places. That is true, especially we had the opportunity of seeing some experiences in Mirador del Paraíso neighborhood. This was an on-site garden or orchard that we implemented. And this was the space that was used for drug consumption and even to commit murder. And this is where if people were killed, they would be thrown down that area. So the people who joined us in this process, we were able to change this situation of violence, and it turned it into an area of respect. And we also built an area where people could gather, because before they would gather on the streets, and we saw a social change in that area. It used to be a garbage wasteland as well. We were able then to transform that environment, and therefore the respect for the elderly was then generated by these street inhabitants as well. The other orchards, these household orchards, for example, in addition to the orchards, we also provided them with tools to help them care for the orchard. And this was also a very violent place. The areas that we have chosen for these orchards are normally flooded with violence, and this has therefore reduced violence, even though it's still present. But it has also reduced illiteracy, because in these orchards, we also provide literacy training, and therefore this has reduced illiteracy, and we have created awareness for these people and
Mil
families.
gracias, Aura.
Thank you, Aura.
Voy a
I
dar la
am going
bienvenida
to
a
welcome
Indira Vega.
Indira
Ella
Verga.
es
She
profesora del
is a
Universidad del
professor from Universidad del
Externado y tiene
Externado.
una
She has a
pregunta
question for
para ti.
you. Indira?
Indira.
Let's see if she was able to connect. She'll be connecting soon. Just a second, please. Good morning, everybody. Thank you very much. The experience has been wonderful and very valuable as well. I would like to ask you, Ms. Aura, what would you have made different, or what are the lessons learned if you would have been able to implement this process differently? And what are the lessons learned about this experience with the orchards? Well, in addition to the planting and harvesting and support process, we have been able to optimize their knowledge based on culture, based on the protection and conservation of habits, because many people in Bogota, for example, Bogota is the area that receives most people in displaced conditions. So we start to lose our habits and customs. Through these orchards, we have been able to learn about these customs and habits, and we have been able to optimize and exchange that knowledge. For example, in the case of gastronomy, we learned about how each of the regions cook, and sometimes we use our own products and they teach us their recipes and we exchange recipes for knowledge and gastronomic ingredients, in addition to understanding the issues present in every region, which are not the same. Here in the center of the nation, we experience a different issue than the ones that are experienced in the other regions in the country. Because, for example, in Choco, the temperatures are different and the systems are different, and therefore the habits are different as well. This has allowed us to understand about the rights in depth as well, not just of the elderly, but also in intergenerational sessions. They have also contributed with knowledge for the youth and children and the elderly. Thank you very much, Madam Aura. Thank you very much, Andira and Aura, for your questions and your participation in telling us about your efforts. So now we are going to continue with Maria Fernanda. Maria Fernanda Vendano, she is a politologist and she is advisor from the City Hall of the Municipality of Cartago, Costa Rica. Maria Fernanda, it's great to have you here. Can you tell us about your project? Hello, special greetings to you all, and thank you very much for giving me this opportunity to tell you about our experience. First of all, I just want to send greetings to my colleague, Veronica Hernandez. She's the person responsible for the program here in the municipality of Cartago, the person responsible for this campaign in partnership with HelpAge. I wanted to tell you that in the municipality of Cartago, since 2014, we started with an elderly program. This has been a priority for the municipality to work with the elderly population. And of course, a strategic line has always been the awareness of the population towards how to behave and how to interact correctly with the elderly population. However, it was in this opportunity and through this campaign that we were able to materialize with the support of HelpAge, that we were able to focus this awareness efforts with the drivers of bus companies in the canton. This was an interesting experience, and for us, it was also very successful. Because of the 15 routes that we have at the cantonal level, we were able to make sure that 12 companies or 12 routes would apply these awareness messages and post them on their buses, and also that we were able to work directly with the drivers. This means that we were able to expand the message throughout almost 90% of the canton, and we were able to create visibility in a more interactive way with clear and specific messages that were also accompanied with urban interventions. What does this mean? Urban interventions. We also used, we call them MUPIs, which are panels or billboards for announcements, which are located in different strategic areas with high traffic from the population. And we also have vehicle traffic that can be seen clearly from the vehicle, but also from pedestrians. It could be in parks or sidewalks with high traffic. And we were able to post these messages with clear and specific messages. And this campaign was also worked on together with the public sector in the canton. And we also conducted internal activities within the municipality so that we can strengthen awareness in the public service towards the elderly. So we took advantage of this campaign so that we could bring it to the elderly population centers that we manage so that we can work with them and with those communities. And we also worked on the internal communication within the municipality so that we could show these images in all computer screens in the institution within certain bulletins and newsletters that we send here. And we also use all communication channels that we have here at the institution. Therefore, we took advantage and we leveraged on these images, which were designed for buses and for these public urban spaces. But what we did was to use them in all channels and in all communication spaces that we would have within the municipality. So in summary, this was our project, just briefly, and I'm sure that later we would be able to delve into our experience. Thank you very much, Maria Fernanda. Thank you very much for telling us about the project. There's a question for you. We want to welcome Gabriela Sala Rodriguez from ADECO. She is the Social Participation Coordinator. Gabriela, welcome. The floor is yours. Let's give her a second. Just like Invita, I'm sure that she will join soon. Well, good morning. Can you hear me? Yes, good morning. My question is, one of my concerns is how the municipality convince public transportation companies so that they would participate in this type of initiative. Well, thank you very much for that question. I must say that my colleague Veronica Hernandez actually worked on this, and I think that it was key to deploy customized efforts. This means that Veronica approached each of the bus companies and she personally told them about the project, the scope and the context of this project, the implications behind it, and also she looked for the flexible opportunities to hand over the material, to install the materials, and how to work with the drivers according with the time and the availability that the company would allow them to. And this was very customized. This means that we wouldn't call it a mass campaign, but it's actually a very customized campaign. And this allowed us to reach the scope that we wanted. In our perspective, it has been very successful. This means that of the 15 bus companies in the canton, 12 of them were part of the project. And that for us is a successful achievement, more than the first experience that we had with that exchange. So for us, maybe the key was to approach the companies one by one to tell them about the project and about the campaign and tell them about the implications and the benefits that we were seeking for the target population. and also managing it in a flexible and customized way with each of the bus companies. And this is how we were able to convince them. We also must say that there was openness from their side that we also recognize and we're very thankful for. And we continue to thank these bus companies for, because they gave us so much openness immediately. We didn't see any resistance to make them listen to us, for example. We did not find any resistance, but rather these bus companies were open to listening to us and participate and be part of these programs. And now we are even organizing a second part of awareness, so to say, with the drivers of some companies who want all their drivers to receive awareness campaigns in the work with the elderly. So we're already working on that. So this means that there's openness from their side and it has been well received by companies, by the bus companies. Thank you very much to you both. Thank you, Gabriela and Maria Fernanda, for the question, the answer, and for telling us about this project. We will continue with Sylvia Manzano. She is a physical education national teacher, and she has a master's degree for elderly residency and health social services. She is also a coordinator of PE at Universidad Nacional de Luján, also a professor at the PE University of Vaneda and Dickens. Welcome. Can you tell us about the project? Hello, Valentina. Good morning, and thank you very much for giving me this opportunity. And I also want to thank HelpAge for considering the Rafan Foundation as one of the engines to drive new low-cost activities. Our project is actually the antidote for solitude, which particularly seeks to include the elderly into a healthy and active lifestyle by practicing sports and physical activity in a physical space, outdoor space, in a park in the autonomous city of Buenos Aires, which also works as an area for PE education. And we involve not just the elderly and the professionals of the foundation to improve the quality of life of the elderly, but it also involves the students of the PE careers so that we can create awareness so that people understand that aging is just a stage of life and that we do not give sufficient importance to this age range. In this sense, we offer gymnastics courses and also newcom courses, which is an adapted sport that is similar to volleyball, that has become a protagonist in the societies of the elderly in our country. And twice a week, we invite them to do exercise. Why did we choose a public environment, an open space? Because this is a great window for people to see them. The neighborhoods actually see them and they ask what is happening. And these PE and sports practices, we put them in the hands of PE teachers with gerontological training, which also by creating visibility of this program, we have been seen by doctors and neighbors in that area. They approached us and asked us what we were doing. And when we told them that our activity was free for the elderly and we wanted them to keep an active lifestyle and healthy lifestyle, then, well, they took us as a reference to send us their patients precisely with all the effects left by COVID for 2 years. And this is how we've been able to achieve great participation and great adhesion to our project. In this sense, we believe that physical activity has to be built as a habit, and therefore the importance of involving professionals who are responsible for this proposal with the elderly population. Habit has to be built from the moment we are children, but socially and culturally speaking, we know that the elderly populations have gone through different paradigms, and now it is fundamental that they take ownership of their body, that they take ownership of their movement so that they can have autonomy and so that they can continue making decisions in their lives, so that they can continue living their lives by giving life to it. And we understand that physical activity should not be an expense for states, but rather it should be an investment. So by intervening in a public space, an open space, and creating this window, as I call it, this allowed us to achieve our objectives. Thank you very much, Sylvia. That's wonderful. So we now want to welcome Maria Montserrat. She is the head of cabinet. Can you hear me?
No, ¿sí me escuchan todos?
Yes, I'm sorry.
Bueno, perfecto.
She's the
Es la
head of
secretaria
cabinet
de
at the
Secretaría para
Undersecretary
Personas
for the
Mayores.
Elderly,
Y
and
ella
she has
tiene
a
una
question
pregunta
for
para
you,
Silvia.
Sylvia.
Bienvenida,
Welcome.
María.
Hello, Sylvia. Thank you very much for your presentation. It's so beautiful how you connected with the active aging, but especially with solitude. It's very important to work with these activities. I was precisely participating in the Newcon interjurisdictional tournament. And I wanted to ask you because not long ago at the Undersecretariat, we noticed that the elderly tell us that one of the difficulties that they find in participating in any activity is the lack of access to information as a whole. So I wanted to ask you what you do to progressively expand this network and make sure that more elderly add on to the different physical or newcom activities or any other activities that you undertake. Thank you. Well, thank you very much for your question, Maria. And yes, this is a great challenge to be able to disseminate this information and bring a message for the elderly to take ownership of. First of all, because there are many elderly people in our country who are not sufficiently active in this sense, what we are looking for, especially in our work as a network, this allows us to create visibility and reach further. And secondly, with these strategic partnerships with educational institutions, such as with PE teachers, where students take ownership and become aware of these initiatives that we have. And through them, we also involve the parents and their grandparents, and also by using these public spaces, this allows us to showcase our projects. Well, thank you very much, Sylvia, and thank you very much, Maria, for the question and for telling us more about the project. So now we are going to continue with Rodrigo Segura. He graduated from ecology at the Javeriana University in Bogota with civil society and public policies in INTEC in Santo Domingo, the Dominican Republic. She has been working for more than 12 years in social corporate responsibility and institutional strengthening. She is currently the executive director at the NTD Foundation. She leads chronic development projects, enjoyment of human rights and social inclusion of the elderly, as well as initiatives to improve the nutritional state and health of this population. Rodrigo, welcome. Can you tell us about your project? Thank you, Valentina. We want to thank HelpAge and AARP for the support that they provided to our initiative. The NTD Foundation has developed different programs in order to improve the quality of life in the elderly populations in the Dominican Republic. Based on this experience, we have identified the need and the importance of valuing the nutritional condition of the elderly as a contribution to improve their well-being and also to determine the theoretical baselines regarding our interventions that are mainly focused on the nutritional aspects in the promotion of healthy lifestyles and the promotion of full and balanced diets and sufficient diets so that the elderly can find well-being in their lives. The project is basically focused on creating the proper nutritional culture and to understand the nutritional condition of the elderly, as well as the knowledge, attitudes, and practices related to nutrition and the way in which they prepare their food and what type of food they consumed on a daily basis, how often, and that type of information that would give us a baseline to determine nutritional advice sessions and to hold workshops and talks in order to improve their nutritional condition and to improve the lifestyles of the elderly. And we were able to organize different sessions with physical activities in order to improve the physical condition of the elderly. Also, bearing in mind that malnutrition, in addition to sedentarism, are accelerators of different diseases, and they also increase the levels of isolation, as Sylvia said, and it increases depression as well. So basically, the initiative conducted anthropometric measurements to determine the nutritional condition. We were able to contact 133 elderly in the region, in the capital city of the Dominican Republic. We also implemented several nutrition surveys, and we held workshops and training sessions so that they could change their lifestyle and diet lifestyle and stop consuming snacks that were given to the elderly through the training sessions and the different talks were, of course, fruits and other types of healthy foods so that they get used to changing their snacks for healthy snacks. So thanks to the support that we received, we were able to reach a larger audience and we were able to obtain data that are going to help us determine the nutritional condition of the elderly populations in the different areas in the country. We actually want to diversify this into different areas in the country, given the partners that we have and other networks we participate in. Thank you. Well, thank you very much, Rodrigo, and thank you very much for telling us about your project. So now we want to welcome Rosy Pereira. She has a question for you. She is the president of the International Center of the unit at the Dominican Republic and the co-chairman of PAHO. Rosy, welcome. The floor is yours. Second, please. She's already here with us. I'm here. It's a pleasure for me to hear the different initiatives of the participating countries. And personally, what has been done here in the Dominican Republic, I think that we can see how we can improve and expand this project, which is relevant and important because we know that health is money. And countries like ours, developing countries or countries in transition, we need to think about how we can invest the limited resources that we have so that we can draw the biggest advantage of them. In this case, for us to expand the project, I think that we would have to do two things, which is to talk to the City Hall of the National District. We want to start at the district level and also replicate this project. This was just a pilot project, but with this, we were able to prove that we can change the way of thinking of the population and guide them towards a healthier lifestyle through nutrition and physical exercise, and also how this elderly population can be empowered. We can see how this orchard project that I really like, we could also do it here through implementing it in different sectors in the city. We could then expand this spectrum and we could also implement this orchard system so that people can have access to healthier food products. On the other hand, I also believe that we could, I actually adopt a commitment to promote this. Right now, we do have a comprehensive health insertion plan that we have designed at the community level, at the hospital level, and at the institutional level. So for us to achieve results, we would have to create incidents in the primary care units because a large number of elderly actually are gathered here. So we want to present this guide and promote this guide as well as the results of these actions so that they can be implemented in a broader scope. Yes, in the same line, in other experiences, we have also combined the body mass index and the different assessments of the elderly with house orchards. In this case, we didn't do this because the purpose was to take them out of their houses so that they could come to these exercise spaces in these open areas in the municipality. But based on what you just said, we have already started talking with the district of Santo Domingo, with the local district, Los Acarrizos, and our intention is to deploy this program in partnership with the Botanical Garden in the city of Santiago, which is the second largest city here in the Dominican Republic, so that they can also benefit from an initiative like this. So we know that through the orchards, we can also improve the access to food products and ensure the food security of the elderly. We can then also intensify the effort. Of course, the more partners we find on the way, then the greater ease we will have in replicating these processes. Thank you. Thank you very much, Rodrigo. Thank you very much, Rosie. Thank you all for your participation and your remarks. And finally, but not least important, we want to welcome Lisandra. She is an urbanist and architect specialized in occupational health security. She graduated from the Federal University of Santa Catalina, Brazil, with a pre-graduate degree and postgraduate degree in architecture. Sandra, how are you? Can you tell us about your initiative? Yes, hello. Hello, Valentina. Good morning to you all. Thank you very much for the opportunity to participate here representing Brazil. with our initiative.
con nuestra iniciativa.
I'm sorry
Ya
about my
disculpe por mi
Spanish, but I
español,
will
pero
try to
intentaré aquí hablar.
give my presentation in Spanish.
Nuestra proposta,
Our purpose was to offer physical activities for the elderly population by using bicycles or tricycles, in Beramark, which would be the coastal region in the city of Florianópolis, Santa Catalina to the south of Brazil. And the idea was to improve the quality of life together with physical activities for the elderly population, where they are used to visit with their family members. This is a tourist place, for example, and also this is a place where many people go to do physical activity. They either walk in that area or ride bicycles or practice skating and other activities. So the idea was to be present there for that time to offer support. We are a team from the Federal University Santa Catalina. We are a multidisciplinary team with doctors, teachers. I'm an architect, for example, but I work with them on urban mobility and healthy lifestyles in this project of global initiative that came from Brazil. And this was actually through this Latin American project that we offered in that opportunity. The acceptance was incredible. At the beginning, we faced some resistance because the elderly many times have never ridden a bike in their life before, or maybe it was a long time ago when they had the experience of riding a bike. So to relive this experience was fantastic for them. And we were able to show them the opportunity and the possibility of riding a tricycle again. That allows them to feel a bit safer than bicycles, which was fundamental for them to accept it. We are showing some testimonies of an elderly person, and he says that it was really good and that, sorry, what does he say? And the lack of balance. I'm sorry, I was trying to read in Portuguese, English, and now in Spanish, but of course we did have security teams as well. Or sorry, we had protective equipment as well. It was during the pandemic, so we had all items necessary, alcohol and face masks and everything. So before we would actually ask them if they had any medical conditions. But then we asked them about the experience and if they would be open to come back and participating from this activity. Of course, it was free, so they had a 30-minute to ride on this tricycle and they could come back whenever they would want. So I think that was it. Thank you very much. Thank you very much, Lisandra.
Muchas gracias, Lisandra.
We would
Vamos
now
a darle la
want to give the
bienvenida
floor to
a
Lisandra Olivia from
de
Geopolis. She
Geopolis.
has a
Ella tiene
question
una
for you.
pregunta para
Alessandra,
ti.
welcome.
Alessandra, bienvenida.
Thank you very much. Thank you,
Muchas
Lisandra.
gracias, Lisandra.
This initiative was very interesting, especially it's such a wonderful location. So imagine the elderly being able to enjoy this initiative. My question is especially, how were you able to identify these tricycles as an initiative to promote mobility for the elderly to enjoy? This means of transportation, did it have a meaning, a social meaning for the elderly? And especially, how did you approach the security aspects of these people, considering their physical situation, the balance, and all of that? Can you please tell us about that? Yes, of course. Well, here in Brazil, tricycles are used as tourism trips, right? We are in a coastal region, so this is a wonderful area to take these types of bicycle trips. So the idea was to connect tourism trips and pleasure, as we call it here, with a physical activity. So we saw the opportunity of merging the tricycle because it's a bit safer, of course, than the bicycle, because resistance would be even greater in that sense. And also, my health colleagues identified the effect of bicycle is much greater than just walking. So it actually exercised the muscular system. So the result of this initiative helped us make sure that they feel safer and that they're not afraid of this, and to do a bit more than just walking, because normally the elderly here, they just walk, right? So it is true that they do not use the bicycle that much, and we were very afraid in a way. But we had a situation where a person had to stop and to breathe deeply again. But we were actually afraid at times, but thank God nothing happened. But the idea is, yes, to do something more than just walking, because it could be something so that they can go see the nature in the outdoors, and that they have the possibility of spotting animals as well on the way by using the bicycle. That's great. Thank you very much. Thank you, Lisandra and Alessandra. With this, we are going to close this first session of the event. And now I want to give the floor to Delfina Alvarez. She's Friendly Cities and Communities for the Elderly advisor. She works in the healthy lifestyle at the Pan American Health Organization. Delfina, the floor is yours. Thank you very much, Valentina, for your introduction. It has been a pleasure to hear about each of the presentations, and I hope that in the second half of this session, we can also have greater detail and to understand a bit more about the initiatives. Before we continue, I want to remind all participants that we have already shared the link so that you can click on it, and we will share the link with you in a follow-up session. It's a pleasure to moderate the second panel, where we will have the presentation from Dr. Maitre Giras. She's a manager of Práctica Urbana, Risk Disaster Management from the World Bank. Dr. Gras, she is the leading voice in sustainable development, equity, and inclusion, with a career covering government, the academy, the United Nations system, and the World Bank. In her current role, she supervises different flagship programs, including the Global Organization for Inclusion based on results. It is a pleasure to give her the floor so that she can present the conclusion and the remarks prepared in the recent report by the World Bank focused on the elderly, and how this is interconnected with the guide and the initiatives that we're presenting today. Dr. Gaz is going to give her presentation in English, and therefore we want to remind all participants that you can have access to simultaneous interpretation by clicking on the interpretation button at the bottom of your screen. Dr. Das, you can have the floor. Thank you.
Thank you so much, Delfina. And I'm apologies for speaking in English. I just want to say thank you to everyone who is connected, and a big thanks to AARP and to PAHO for inviting me here. It was very interesting for me to listen to the projects that you all presented before, and to see the many innovations that are taking place in various countries of Latin America, where aging is growing and populations are getting older as compared to 20 years ago. There are a lot more persons over the age of 65. But worldwide, there are more people above the age of 65 than there are children under the age of 5. So let's just get that around our heads. All over the world, more people over 65 than under age 5. And that's a reality for most of our countries. We brought out a report in earlier this year. It's called Silver Hues, Building Age-Ready Cities. And we were asked, why are you talking about age-ready cities when we already have age-friendly cities as an idea? And what we are trying to do is this. Some countries are already seeing aging today. So countries such as Japan at one end of the spectrum, many countries in Europe, many countries in Latin America are already seeing aging. You can see it, it's very visible. You don't see very many children, you see more older persons. But there are countries in many parts of South Asia and in sub-Saharan Africa, which have very large youth cohorts. And they are aging because, of course, everyone is aging. They are aging, but they're not aging at the same level as other countries. So they will age, they will begin to see aging as a policy priority in 10 years, 20 years, but today, most of them are not. So to them, we say, we need to build readiness for aging. And there are many reasons for this. And one of the reasons that we highlight in our report is that building age-ready cities, making investments in infrastructure, in housing, in technology, in roads, in transportation, is not just for older persons. It is for the entire city. It is for the entire society. So there are huge co-benefits to investing in age readiness that go far beyond older persons, beyond their caregivers, beyond their families, and beyond their proxies. It is for everybody. It is for that parent who is wheeling a child in a stroller. It is for that person who is carrying a heavy load or a suitcase up a hill. So it is for many people and not just for older persons. That's one. The second thing is that we need to move away from a narrative of just vulnerability of older persons to assertion and agency of older persons, which most of your projects highlighted, of active aging. But more than that, aging also has a very strong economic rationale to investing in age readiness. There's an economic rationale, there's a social rationale. This is because the silver economy is a huge opportunity for investment, and many private companies are realizing this and making those investments. So I think that you already have the link to the report. I'm not going to belabor these points. You can already take a look at some of the recommendations that we have in our report. I will just end by saying that we need to focus our policy priorities more on building back before rather than building back after. By what that means is that when you put a big piece of infrastructure in place, it is much easier to, at the building stage, make way for universal accessibility, universal design, and aging, rather than retrofit it after the fact. You can't suddenly wake up and say, oh, my doorways are not wide enough for a wheelchair to go through. That's going to take a lot more money than initially building a doorway that is already accessible. A final point that I wanted to make is that most cities, most countries pride themselves on the idea of cities for all. They pride themselves on ideas of an inclusive city. And older persons in that city are extremely important to take care of, not just in terms of designing special or segregated projects for them. In fact, not at all those, but in terms of multi-generational spaces that are both physical as well as social. The final point that I will ask you to take away from this is that when we talk about age readiness, we need to integrate the idea of infrastructure, which is both physical infrastructure as well as social infrastructure. And absolutely finally, I do believe that COVID has given us an opportunity to rethink what we do as in terms of policy priorities with respect to aging. So I will stop there, Delphina, and hand it back to you unless you wanted me to ask the question to our panelists now.
Thank you very much, Dr. Das. Yes, but first of all, I would like to ask all panelists to turn on their cameras for the next session and the next panel. Thank you once again for introducing the report prepared by the World Bank and your excellent comments. Of course, we need to highlight the importance of working with friendly environments with the elderly, but that are also friendly with all. I would like to invite you to ask questions to the panelists so that you can understand more about this and to interact about the World Bank report and the initiatives included in it. Then I will give them some minutes to give a response according to your questions. Thank you.
Thank you so much, Delfina. When I was listening to all of the panelists, what struck me was that many of these were very strong community-driven initiatives. They were really embedded in the culture, in the context, in the norm. My question is, if you were to see this scaled up, if you were to see this informing policy, what are the kinds of steps that you feel you or others would need to take to see that initiative scaled up?
Thank you very much, Dr. Das. I think that we can start with Sandra Garcia from Brazil so that she can give a comment about how to scale the initiative and which could be the steps that she can recommend us. Thank you.
Gracias.
Well,
Nosotras, por la universidad,
at the university, we are a public and federal university, and we do have a space at the university to offer and to continue offering these bicycle rides as part of the PE course at the Federal University. So we do have some offices that do this throughout the semester, but now for a longer period of time, with this initiative, we only have been able to buy 4 tricycles. So we have to offer the services during different timeframes during the semester. So in the future, we will have shifts twice a week with the use of this tricycle, with the support of physical teachers, physical education teachers. In addition to that, we have nutritionists, doctors, and since each of them are university professors, they do have different approaches in these processes, and they can be able to offer assistance throughout time. So here at the university, we have information so that we can continue assisting them, and maybe throughout the year, they can continue with this constant physical activity in their lives. That's the idea. Thank you very much, Lisandra, and thank you very much for highlighting the efforts with intersectoral coordination with the university and each of the areas of the government in the cities. I want to invite Ms. Kaliman so that she can tell us about how we can scale up the urban orchard project at a global level to create more impact. I just wanted to add something else. I believe that at the end of the week, we want to go out of the university and offer this in other spaces in the city. We have the coastal region in the island, but we also have another coastal region in the continent, which is also the large city, the large Florianopolis. And the idea is to offer this in different locations in partnership with the municipality of the city in the region, where we will have the possibility of leaving the university as well, so that other elderly in the city as a whole can have the same opportunity. Thank you. Thank you, Lisandra. So now, Aura, the floor is yours, please. Thank you. We believe that we can optimize the communication resources either by word of mouth, as well as with the physical and technical opportunities, because by building these networks, we can expand the spaces where we can deploy this proposal in, including more elderly people, and expand the coverage, because we believe that we have asked for support from the entities, but unfortunately, the spaces are very difficult to obtain, but also the cost embedded in here. In this case, some organizations have had to invade public spaces, even though we are protecting the environment with our activities, but unfortunately, authorities don't always understand. And many of our orchards were actually shut down many times because of this, because authorities do not understand this. And unfortunately, our sector is very much ignored, except for you who have helped us, and you have helped us create visibility of this and to create awareness in the elderly populations. We still have, however, to create more awareness efforts with public officials and in the entities as well. Therefore, we believe that by expanding the coverage and expanding and opening up to public spaces with more resources and with more techniques, by understanding and learning how to use these techniques, especially communication techniques, we can then optimize the resources and help more people. Just here in our neighborhood, we have 70,000 people, but in the whole of Bogota, there's 1,500,000 people, and Colombia has 6 in total. So hopefully we can expand it throughout the nation. It is ambitious, but it is possible. Thank you very much, Aura, and thank you very much for highlighting the importance of the resources, as well as changing the perceptions of people about aging and about the elderly population. Now I want to invite Maria Fernanda to share her comments with us. Well, we believe that this project has this advantage and the capability of escalating the experience to other bus companies in other cantons, or even at the country level, sorry. The audiovisual material that we created with this campaign can be reused, and it applies in terms of the language that are used. It's applicable at the country level, and the audiovisual design as well is easy, understandable. So I just want to talk about the coverage at the cantonal level between the people who were involved and the potential users that were able to see these campaigns. We had more than 90,000 people as a whole. It is very easy to escalate this and to be able to reach a greater coverage of the message. And what is more complicated, however, but not impossible, is the complementary work that we wanted to do with this communication campaign, which is working with each of the bus drivers. We've had bus drivers who have participated, and they have shared time with elderly in the different elderly centers. So this, of course, is scalable and replicable, so that the bus drivers can visit other centers in their communities and where they're driving their bus routes through, but it does require logistics support and coordination between different instances. We believe that this with local efforts, but it can be applied at the national level with the Ministry of Public Transportation and other authorities at the national level that can help us channel these messages. So I think that it is viable. Thank you very much, Maria Fernanda. And thank you for highlighting the importance of intersectoral coordination to be able to expand and scale up these types of projects. I would like to ask Rodrigo to now give us some comments about his efforts. Yes, in relation to what Dr. Das mentioned, we use networks, social media, as part of the scope of the project we actually prepared an exercise guide for each of the people. You can't really see it, but okay. This is a poster that we put on the wall so that people can remember the exercises that they did so that they can continue doing them at home. As I said in my presentation, we are also open to creating strategic partnership with local and government partners, but also with private entities to find the proper financing. We believe that the initiatives, even though we don't have many resources, they can be implemented and they can be undertaken easily if we can use and optimize our resources. So I think that we need to leverage on our networks, establish new partnerships, and to be able to optimize available resources. Thank you very much, Rodrigo. And this is also in relation to what we presented in this guide. And finally, Sylvia Manzano, would you like to give any final remarks? Yes, thank you. Well, we are truly convinced our area of interest is sports and physical education. We do work with some PE teachers. In our country, we have almost 200 PE teachers, and this topic of aging is an optional aspect. We need intervention from the state so that this issue of aging can be understood as part of life and that is included in the syllabi, not just an optional subject, but this has to be related to PE. And if this training would have existed, then PE teachers could also open up the doors to create sports, recreational PE activities for the elderly. And these activities could be undertaken by professionals, returning to the community what the community does for them. And this is why in Argentina, most PE teachers and PE activities are free and they are covered by the state. We believe that we could do this. We have been working to see how we can create more awareness for decision makers in our country so that this can become a reality. Thank you very much. Thank you very much, Sylvia. So now I would like to invite 3 people from the audience with great experience in healthy environments with the elderly so that they can ask any questions and give any brief remarks to the different panelists. For this, I want to invite Professor Silvia Gascon as well as Ms. Silvia Sanchez and Mr. Shintaro Nakamura to turn on their cameras so that they can ask their questions. We are going to group the 3 questions in one single block, and I am going to ask the panelists to answer in a general way and as brief as possible so that we can be on time. So first of all, I want to invite Dr. Sylvia Gascon. She is a global director of HelpAge and director of the university. Can you please ask your question, Sylvia? You're on mute. Well, first of all, thank you, Delfina, and thank you all. It's great to see this partnership between HelpAge and the Pan American Health Organization that has strengthened the work of many people in different places of Latin America. The question is in line with the discussions that we've heard. Those who participate are always the same. So how can we make sure that we reach other people who do not have this motivation, and how can we reach more people or scale the activities, as we said? And my comment is that the post-COVID, the pandemic actually left a strong impact on the elderly, and many of them are still back at home. They don't want to go out. So how can we balance this, which is to encourage them to go outside when we know that they don't feel comfortable yet. So we need to continue promoting social interaction. I want to congratulate you all. I loved listening to you. Thank you very much. Thank you, Sylvia. So now I want to ask Norma Sanchez, Operations Manager from Salera Concha from Colombia, to ask a question, please. Thank you very much. These wonderful experiences have been great, and thank you very much for sharing your knowledge with us. I would like to ask you if you have explored how technology, and of course, part of what the pandemic showed us is how these technologies can help us strengthen initiatives and maximize experiences and generate savings at times and to facilitate communication. How do you think technologies, IT and communication technologies and all these different developments could strengthen this practice, this experience? And what do you think could be a barrier that you could be facing if you want to maximize it with the use of technology? Thank you, Norma. Finally, I want to invite the Senior Advisor in Social Security from JICA, Mr. Shintaro Nakamura, so that he can ask his question.
Thank you very much for inviting me for a question. Hello, I'm Shintaro Nakamura from JICA, Japan International Cooperation Agency. It was really inspiring to hear the many initiatives in Latin American countries focusing on different aspects of all the adults' lives and the communities. And my question is about the project's alignment with the local context. Now, my question is quite general. So what specific local contexts were considered for successful implementation of the project? For example, when we designed the long-term care project in Thailand, we took advantage of the Thai robust public health infrastructure and the local health volunteers. They have million local volunteers nationwide. So we trained them as a caregiver. And also some daycare activities took place in temples. So we took advantage of cultural context of the or religious context of the Thailand. So I ask this question because the alignment with the local context, whether it is institutional or social or environmental or cultural or religious, alignment is essential for the cost efficiency and the sustainability of the project. Thank you.
Thank you very much, Dr. Shintaro. I want to ask each of the panelists to answer and give their comments briefly about these three questions. How can we scale up the projects and how all the elderly can have access to this? What are the technologies and what are the local contexts? I want to ask Aura to give her comments first. Well, as part of the training processes, we consider in technical aspects, we taught them how to use computers and especially the cell phones or smartphones, because we all use the famous cell phones, but our children also sometimes purchase technology for us, but we know how to use it. This is we have the problem. So in this training process, we consider the technology. We do have a specialized person who's focused on working with the elderly. He is an engineer. Well, he has an IT specialization and he is responsible for holding the different workshops with them. So this can help us achieve better results because the excitement of using this means of communication that we didn't know of before. And secondly, it's this autonomy and that independence, and not depending on my son to help me use the cell phone and to take the pictures because I didn't know how to do this. This has given us great result, and this has expanded our coverage and the willingness to participate in this process. Thank you. Thank you very much, Aura. Let's move on, please. Celia, please. Yes, in relation to technologies, that was interesting because there's no excuse to not move around, because even though we work in open spaces and natural spaces, if we have any weather condition, then of course this will force us to meet on Zoom or Facebook or by using different devices that we had to teach them how to use so that we can keep in touch. So we are aligned with the standards of the WHO every day for 30 minutes so that you can live longer and with a better lifestyle. And in relation to leveraging on the context, we were also analyzing different studies, especially one from the Argentinian Catholic University by the Observatory of Social Debt in 2016, which showed that 77% of the elderly population older than 60 years doesn't practice enough physical education or exercise. And therefore, that is our niche. This is our concern. It's focused on elderly people older than 60 so that we can deploy different strategies so that people can take advantage of these public spaces, so that they first connect with a professional that can provide them with tools through the different physical activities, and that they can build a habit in their lives so that they can have that autonomy and the willingness to enjoy their body in movement to continue living. Thank you very much, Sylvia. I would like to invite Rodrigo to give us his remarks, please. Yes, in relation to IT and communication technologies, we also developed multimedia audio visual material that we can use in order to disseminate the initiative. And also, we had a person responsible for the physical exercises. The idea is that they can guide the elderly in the use of those activities. When we involve the caregivers of the elderly, which in many of the cases it's their family members and the younger family members, they can also follow up on these physical activities, but also on the nutritional aspects, which are also of our interest, and how to take advantage of the context. Of course, the context in our case, the social context, was determining for us to hold our activities based on a joint diagnosis with the elderly people in relation to what were the times and the dates that were better for them to participate. And we actually, through this consultation and this sense of belonging and to be part of the initiative as such, and not as if it was an imposed situation. Basically, thank you. Thank you very much, Rodrigo. I would like to give the floor now to Lisandra Garcia. And also, if you would like to comment on the local context and the local environments, this is very important so that we can answer Dr. Shintaro's question. Yes, I think that here in Brazil, the first question then, the barrier of the pandemic was actually significant. It affected the participation in public space. They were outdoors, but they were still afraid of getting COVID. So I think that now the elderly are coming back and they are going out again. So we hope that this can go back to normal gradually. The university as such is a space where we can find different volunteers for these projects with social activities.
sociales. Então, nós outros
So we do
nós
have
contamos
many
com muitos
postgraduate
alunos de
students,
pós-grado,
pregraduate
pregrado,
students
graduação, para
to be there present in the
no
public
espaço público.
spaces.
Era aos
And it
finais
was
de
during the
semana,
weekend
então
as
se
well.
imagina
So
hacer
imagine
juntar las
gathering
personas
these people.
fueron
They were
personas
volunteers
voluntarias
from
de
the
la universidad
university
que
and they
ayudaban a
helped the
los
teachers
profesores
in
en
the
esta
initiatives.
iniciativa.
So I
Creio que
think
es
that
muy
it's very
importante tener,
important to
estas iniciativas en la ciudad, una
have a
campaña de
dissemination
divulgación,
campaign and
también
also to
contar
have
con
the
las personas que están
students
estudiando y
with
tienes
the
disposición,
willingness
né,
to help and
en ayudar
participate
y
in these
participar
initiatives. I
nessas
think that
atividades.
it's
Creio que es
very
muy
important
importante mesmo, porque es
because
muy
it's
difícil,
very
né,
hard to do
hacer esse
this
trabalho
work
com
with the
recursos, né, que nós
limited
temos para
resources
poder
to be
ter
successful.
sucesso.
And now in
E na
terms of
questão
the
da
technology,
tecnologia,
just to
só
add
para complementar a
this
terceira, na
third comment,
tecnologia, creio que
I think that
temos
we have an
a ideia de
idea
fazer no sítio, até marcar
of
a
creating
locação, a renda
different
pelos
timelines of
passeios, para que
this
estimule os
bike rides
adultos
so that
maiores a
the
utilizar
elderly
os
can use their
celulares, porque
cell
na
phones.
pandemia
During the
foi algo
pandemic,
que
this is
se foi
something
motivado
that
por la
was
necesidad de
generated because of the
comunicación
need
con
of
la
communicating
familia,
with the
con las
family members
personas.
and the different people.
Entonces,
So the
creio que a ideia
idea of
é tentar hacer com que ellos estejam cada vez
making
mais
them more
próximos de las
familiarized with technologies
tecnologias
in
em coisas pequenas
small
como
things, for
orientar
example,
para
but to
saber
know
quando
when
e
and
dónde
where these
estarão os
tricycles will
triciclos
be
neste final de
during the
semana,
week,
por
for
exemplo, e
example, so
quero
that
ser,
they can
né,
schedule their
convidar
time to
para
go
ir.
there.
Então,
This
é
is
um
a dream of
sonho,
ours.
todavía
We
não
still don't
temos
have
isto,
this
né,
implemented, but
curso,
that is
pero
the
a ideia
idea
é
so
essa,
that we
para
can
que
consider this in the
consigamos.
future.
Yeah.
Thank you very much,
Muchísimas
Lisandra.
gracias,
And
Lisandra.
finally, I
Y
will
por
give
último,
the
le voy a dar la
floor to
palabra
Maria
a
Fernanda
Fernanda
Daño so that
Daño
she
para
can give us her
desarrollar
final
sus comentarios
remarks.
finales.
Yes, maybe I could mention that in relation to the local context, the municipality of Cartago has a specific situation, which is that we have an elderly office. This is a local characteristic of ours because the communication campaign wasn't just from the communication department of the institution, but we were careful to work on it based on the perspective of the elderly and based on their interests, and also prioritizing the values that we wanted to communicate or the messages that we wanted the elderly to prioritize and assimilate. And in relation to technology, I wanted to mention that the communication campaign, in addition to social media, not just with the physical material that we put on the buses, but we also had the support of the family members as well as the community in the case of the elderly centers, so that we can bring this population closer to technology so that they don't feel isolated from modern times. And I also want to mention that the campaign also included videos which were acted out by the elderly. These were some announcements or sketches that we prepared. And they also had that experience because these were short videos that we were going to share on the social media. So we also told them about how we posted this and how we disseminated the videos in the social media. This also brought them closer to these communication channels that they weren't familiarized with. Thank you very much, Maria Fernanda. And thank you very much for highlighting the strategy for involving and to put the elderly in the center and to make decisions with them as the main engine for decisions. I would like to thank all participants and panelists for your questions and your comments. And I'm sure that there are many things yet to be discussed, but we hope that this is just a first of many encounters. Finally, I want to invite Daniela Bustamante so that she can give us her final remarks and close the event. Marcela, the floor is yours, please. Well, thank you very much, Delfina. I would like to thank you all for your participation, for joining us today. We also want to thank our special guests from Argentina, Colombia, Chile, the Dominican Republic, Japan, for your interesting questions. This helped us guide the discussions as well. Before I close this first event, I would like to share some final comments with you After this
Fue que fue
wonderful journey that
maravillosamente
we
nos dimos la
embarked on
mano
together
con
with AARP and the Pan American
PAHO,
Health
junto con
Organization,
nuestros
together
socios
with
de
our
Costa
partners from
Rica,
Costa Rica,
Argentina,
Argentina,
Colombia,
Colombia, Brazil,
Brasil
and
y
the Dominican
República
Republic.
Dominicana.
First of all, it
Primero,
is
es muy
inspiring to see
inspirador
the
ver la
power
fuerza
of
que tienen las
innovative
ideas
ideas.
innovadoras
And
que
even
aún
though
están
they
de bajo
imply low
costo,
cost or
cero
zero
costo,
cost, they
generan
generate
cambios y
high
impactos
impact in
en
the
la vida de
lives
las
of the
personas
elderly.
mayores.
Secondly, it is
Segundo, es
invaluable
invaluable el
to
trabajo en equipo,
see
el
the
trabajo en
team
equipo, la
efforts
gente
and
con
the
la
work with the
comunidad,
communities
el
and
trabajo en
network
red,
efforts
lo
because
que
it
hace que
allows
se
us to
maximicen
maximize
los
resources.
recursos.
Thirdly,
Tercero,
working with whatever is
trabajar con lo
available
que
and
hay,
whatever is
con lo que ya
existing
existe, con lo que hay,
is to
capitalizar de
capitalize
alguna
our
manera los
assets
activos
and
y aprovechar lo que
leveraging on them systematically.
Cuarto, los
Four,
pequeños
small
pasos
steps
llevan
lead
a
us
grandes
to
cambios,
great
por
changes, as
sencillos que
easy as
estos
they might
sean.
be. And five,
Quinto,
the
la
voice
voz
of
de las
the
personas
elderly
mayores
should
debe
become
ser
the
el
focus
centro
of
de cualquier
any
iniciativa.
initiative. So
Bueno,
we hope
esperamos que
that
se vayan
you have been
inspirados
inspired
de
with good
buenas
ideas
ideas
so that you
para
can
implementar
implement
en
them
sus
back in your
comunidades,
communities,
en
in your
sus
local
contextos
context.
locales.
And
Y recuerden
remember to
siempre tener
always bear
presente
in
que
mind
vamos
that
a
this is
lograrlo.
possible.
Feliz
Have a
tarde
good
para todas y
afternoon.
todos.